Hello, how are you all? Hope you are fine and preparing for the AMC Part 1 exam. So, this will help you to solve some tricky question from the gynae section for the AMC Part 1 exam. So, let's start without any delay. So, this is a question. A 31-year-old woman gave birth to a baby of a normal weight through vaginal delivery. The delivery was complicated by a small perineal tear that taken care of without stitching. Today, on the fifth day postpartum, she presents with a heavy, bright red vaginal bleeding. She mentions that the lochia was in a scant amount after delivery compared to her previous pregnancy. On examination, she has a temperature of 38.8 degrees centigrade. The uterus is mildly tended to palpation. Which one of the following could be the most likely diagnosis? A. Endometritis. B. Infection of the perineal tear. C. Retained product of conception. D. Cervical tear. E. Uterine rupture. The first option, which we should not pick at all, is the uterine rupture. Why? So, what will be the uterine rupture scenario? This is not at all the scenario of the uterine rupture. In the uterine rupture scenario, they will give you the history of VBAC. What is VBAC? Is a vaginal birth after cesarean section. They will definitely mention in the scenario that this patient is having a previous cesarean section, and this time she went under a vaginal delivery, and as well as they will, along with this, they will also mention that vitals will be disturbed in the uterine rupture. They will definitely give you the vitals. Patient always with a uterine rupture presenting with a tachycardic, hypotensive, and the vitals will be disturbed. They will give you here only the temperature mentioned. So this is no there is no association of uterine rupture uh, with this scenario. Along with this, always remember, in case if there is a patient is not delivered yet, so CTG will be the first finding which will disturb in the VBAC scenario, in the uterine rupture scenario. So this is not the case of the uterine rupture. So we will not at all pick up this option, uterine rupture. Easily we can rule out this. What about the cervical tear? Cervical tear, how we will diagnose the cervical tear? Always remember the cervical tear always presenting with primary postpartum hemorrhage. Here you can see this is the case of secondary postpartum hemorrhage. She is presenting on the fifth day postpartum with a heavy bleeding. So what is the primary PPH? Primary PPH is the patient presenting with the bleeding after delivery within 24 hours of delivery. From delivery to 24 hours, this is the primary PPH. And always remember that cervical tear always presenting as a primary PPH. Whenever the patient is delivered, cervical tear massively bleeding at the after delivery. So this is the clear cut case of the primary PPH. This is not happening with the secondary PPH, cervical tear bleeding. And at the time of the cervical tear, we have to stitch this, otherwise this will massively bleed, and this is a case of primary PPH. So this we will not pick. What about the infection of the perineal tear? Infection of the perineal tear is also the wrong option here. Why? Yes, this statement is directing that this is the infection, that she's having a fever, but infection usually not presenting with a heavy red, bright red vaginal bleeding. So if it's heavy, bright red vaginal bleeding, this is a case of secondary PPH. Or as well as for the infection of the perineal tear, they have mentioned there was a small perineal tear only which was stitched. So that's how we will not pick this option, because it will not present with a heavy bright red vaginal bleeding. And in the scenario, there is nowhere in the scenario that mentioned that that was a uh, extensive perineal tear, third degree perineal tear. So infection usually happening with the third and fourth degree perineal tear. So here in the scenario, there is not at all mentioned, so we will not pick this option. What about the endometritis? Endometritis is also the wrong option here. First of all, the endometritis will never present with a mildly tender. Endometritis always presenting with a severe tenderness. Remember, with the severe tenderness of the abdomen, endometritis is the first option along with the temperature. Fever is one of the most common reason. Endometritis is one of the most common reason of the fever, but here they have mentioned that uterus is mildly tender to abdomen. In endometritis scenario, always the uterus will be a severely tender. And as well as the other statement which is not favoring that this is the case of endometritis is lochia. Lochia, always they will mention you that there is a lochia, they will always mention you that there is a heavy foul smelling lochia. These endometritis, in the endometritis cases, these patient always presenting with a foul smelling lochia. Lochia, they will mention that the patient is complaining of smelly lochia, yellowish vaginal discharge is coming with a severe tenderness on the abdomen. That's how the endometritis we will this the scenario will be, but this is not the scenario of endometritis. This is a clear cut case of retained product of consumption, because this is one of the most common cause of secondary postpartum hemorrhage. The option C is the correct here. Let's read the explanation as well for this options. Correct answer is C. The presence of secondary postpartum hemorrhage between 24 hours and 12 weeks postpartum hemorrhage that is bright red and fever suggesting the retained product of consumption RPOCs. So this is the correct answer, retained product of consumption. The second thing, scant amount of lochia in the first few days after delivery suggested that the placental site may have not undergone involution, probably due to the RPOCs. Usually retained product necrosis with fibrin deposition and may eventually form so-called placental polyp. As the scar of the polyp detaches from the endomyometrium, brisk hemorrhage occur. So that's how this is the case of retained product of consumption, because the patient presenting with a scant amount of lochia. In case of endometritis, patient is having a fever, offensive odor, lochia, and abdominal pain and tenderness will be the severe. So endometritis is the most common cause of postpartum fever in the first 5 days, with a peak incidence between day 2 and day 3. So, although vaginal bleeding can be a feature at occasion, bright red bleeding makes endometritis less likely, because usually they are presenting with the offensive or smelly lochia, or lochia will be a yellowish discharge will be there. So, this is not the case of endometritis. Genital laceration are the another cause of postpartum fever, and usually presenting between day 4 and day 5, but patient here presenting with the bright this is not favoring. Then cervical tear is also, we already discussed that this is not presenting with the secondary postpartum hemorrhage. Usually they are presenting with the primary postpartum hemorrhage, and uterine rupture is very unlikely to occur after 24 hours of delivery.